This is an orthokeratology case regarding a patient who's worn lenses for just a little bit under 3 years, and not immediately, but over time, the lenses have decentered laterally. And the question is whether that should be corrected by making changes to the patient's existing lens designs, or whether this patient should be temporarily taken out of the molds and allowed to wash out and start over again. Anytime that I encounter unexpected changes over time, um, I do consider a washout. It's usually a last resort, but if that's what's required, then that's what's required. And there are a couple things I look at to determine whether that's really what's needed. The first is, how confident am I in the initial topographies? Did I have a hard time getting a good image because the patient was young, had small palpebral fissures, had a poor tear film, or wasn't able to fixate very well? And then the second is when I'm looking at the sequence of post-wear data, does the data tell a story that makes sense? If the data is conflicting, or I'm not very confident in my initial post-wear maps, or a combination of the two, my initial pre-wear design maps, then I lean towards a washout and starting over when necessary. So let's go ahead and see how those criteria apply to this case here. Here on top I have the raw images shown, and then down below the processed images. If we look at the raw images, the patient looks like they're fixating pretty well. There's very little interaction from lids and eyelashes. And if you look at the rings, especially in the pupil where you can really see them, they look fairly sharp in both eyes. Now if we turn on the colored rings, the extrapolation is pretty well centered relative to where the original Myers were in both eyes. There's a little bit of waviness up here that I would sometimes delete prior to extrapolation. Also, same thing superiorly in the left eye. I don't really think those are affecting your lens designs, and I'm not too worried about those. The processed images likewise look pretty good. Nothing irregular that I can see. A little bit up here, possibly from the rings that are wavy. Same in the left eye, but again, I don't think those are really affecting the lens designs. So I would say these look pretty good. They're what we would call good design quality topographies, and based on what I see here, I really don't see any evidence or reason to do a washout thus far. So I'm going to pause the video and then bring up some post-wear maps. Here we're looking at the post-wear maps, and the top set shows slightly better centration, slightly decentered nasally, but very mildly. These images are from a little bit over 1 year after the initial fit, and then down below we can see that there is more nasal decentration. These images are from about just a little bit under 3 years after the initial fit. You can see that you have two treatment zones, indicating that there are times when the lens is fitting better with better centration, and then there are times when it's traveling nasally, both in the right eye and the left eye. If we look at the earlier maps, one thing I notice is that there's a little bit of looseness here on the nasal edge, especially in the left eye. A little bit in the right eye, not as noticeable, but the lens is a little bit flat in this area. It's not bearing down on the cornea quite as much. And for this to progress to this is, I think, fairly reasonable. Same with the right eye. There's not quite as much looseness in the nasal periphery, but there is some. And for a lens to gradually migrate nasally at times for that reason, I think is pretty reasonable. So overall, due to the good quality of your initial topographies and the fact that this appearance transitioning to this appearance is not totally unimaginable, I don't think this patient needs a washout. I would make changes to the lenses based on the most current design and go from there. The lens changes themselves I'll detail in a separate video, but before getting to there, a couple other thoughts that I thought I'd bring up. One is I'm not sure if this patient is wearing the original lenses from the dispense. It's been almost 3 years, I believe, since the initial fit. And if these are the original molds, then I would take a look at them. If the patient is a heavy depositor or is not very diligent about cleaning the lenses, if they're very deposited, perhaps to the point that they're causing a superior tarsal papillary reaction, that may be pushing the lens around. Or sometimes I've seen the opposite. If a patient is very aggressive in cleaning their lenses, especially with a cleaner, an abrasive cleaner like Boston Advance, I've seen patients alter the fit of the lens by really going after the back surface curves with a cleaner. And over the course of 3 years, it is possible, I think, that the fitting relationship of the lens to the cornea has changed because the patient has actually physically changed the back surface of the lens. These scenarios are not that common, and again, I don't know if this is an old lens or perhaps it's been changed recently, but those are some thoughts I'd consider. Again, the specific changes I'd recommend to the lenses will be detailed in a separate video. Hope this has been helpful, and thanks for watching.